Hello class, and welcome back to online presentations. This is radiological anatomy. Let me first say before we start off here that basically the diagnosis of disease conditions based on radiographs is a thing left for veterinarians. Chiropractors do not make diagnoses based on radiographs. So you might say, why are we teaching radiographic anatomy? The purpose of this is to allow you to be able to recognize conditions. I think you should review radiographs, looking for contraindications for adjusting prior to adjusting animals, especially animals always worried about ununited dens like that, and consider it as a possibility. I think you need to know what the animal anatomy looks like on the radiograph, but in general, be very careful about making a diagnosis something left up to the veterinarian, and the veterinarian needs to be doing this. So having said that, let's continue on with this and see out here. So again, we're trying to teach normal anatomy, and as I said, be careful about making diagnoses. And I always request people bring in to my clinic when they come in with their animal. One is I want current proof of rabies vaccination for my protection and my text, plus it's a Texas state law. That's something we can discuss later on, but basically all animals are vaccinated against rabies. And the second I like to do is see x-rays, and the reason I want to see graphs is because I want to see if there's any contraindications to adjust. So it helps me as far as identifying specific subluxations. Veterinarians on radiographs, radiographs are always necessary to find solutions. I think you can see subluxation sometimes on radiographs, but sometimes you can't. So I want to see those more for contraindication and to try to help the patient understand what's going on with the animal. So hopefully it's clear, and hopefully not too verbose as we get into this. Two basic series for radiographs: the ventral dorsal view, what you chiropractors call AP or P to A, where you want to set the patient up by the film, and then laterals. Two basic views. So AP or P to A, VD as we call it, and then lateral. Basic series of abdomen, ventral lateral for abdomens, as we just said. Here is the abdomen of a cat. This is a radiograph. You can see lots of structures here. Here's spleen, here's kidneys, there's a urinary bladder, intestines. This is air all in the intestinal tract. You can see the vertebrae. Again, cats have 7 lumbar vertebrae, 3 sacral vertebrae, and then a bunch of coccygeal vertebrae back here. 6, 5, 4, 3, 2, 1. And I'm not sure what that is. I think it's just a fold of tissue there, nothing to be concerned as far as maybe another or something. It might be, I don't know. It's so weird. Here's a lateral view of an abdomen. Again, there's a diaphragm. Here's a bladder, intestines. You can see they're kind of balled up here. Lots of little fat in this cat. This is a fat cat. Thoracic series, again, VD and lateral is for thoracic series. Here's a VD on this. Here's a lady trying to hold the animal. Most veterinarians will sedate animals prior to taking rabies, but sometimes the owner won't let you, or you're just able to because of the animal's health. Here's a lateral film, excellent looking lateral film here. Here's a vertebra. This is a chip. Okay, this is a identification chip. Animals are microchipped to try to find their owners. It's usually placed subcutaneously between the shoulder blade. Sometimes this chip can migrate. You can find it around here, sometimes on the animals, but that's what that is. Here's the scapula, here's the humerus, sternum, cardiac shadow right here. Here's trachea, this diaphragm, here's liver. You got those to look at as well. Pelvis, again, VD gives most information on pelvises. You do, but won't show you as much. Here's a VD of a dog. You're looking at this femoral joint, and I don't like how square these femoral heads are on this dog. Normally it should be more rounded. I'm a little concerned about the squareness of this fossil femoral joint. So you can see the pelvis. Here's the ilium, ischium, the pubis. Here's the sacrum. Here's L7, transverse processes, air and intake tract. The lateral view. Here's the anterior foramen. There's coxofemoral joints. There's ischial tuberosity. There's posterior superior spine, or tuberosity, tuberococcyx down here. There's the sacrum. Here's L7, L6. There's a coccygeal vertebra. Nice disc spaces here on this. Spinal view. Again, I like a VD and a lateral view of the spinal view in question. I like these before I adjust them. Again, I'm looking more for contraindications. I'm also looking for pathologies, so I can sit down and discuss these with the owner. Here's a cervical view, VD of the spine. There's the wing of the atlas. There's the odontoid process. Now, you want to make sure you can see this, because in these young dogs who are in cervical issues, you may see ununited dens here, and you don't want to adjust dogs. Here's a body of C2. Nice disc space right here. You can see the fist joints. Here's a lateral view. Here's the axis, the spinous process of the axis of dog. Here's the atlas. There's the ostoid, sinus, occipital condyle. See the disc space here. Zygapophyseal joints. A nice looking radiograph of this dog. Here's a trachea, hyoid apparatus, C2. These are just folds of skin. Lots of skin in this dog. Again, there's a trachea. You can see little cartilages in this dog. Nice disc space between these vertebrae. You can see the dent here pretty much. Not a very good radiograph, to be honest with you, but it shows C1, 2, 3, 4, 5, and C6. There's you see how C7, even this dog here's 1, 2, 3, 4, 5, 6, 7. Pretty far back here. It's hard to adjust. A little blurry on this, to be honest with you. There's C2, there's C5, C7. It's hard to, nice space there. I don't like this reach here. This looks kind of dirty to me. And this is not the best film in the world. Here's a VD of a cat. L1, L7 body. You can see how the cat pelvis is more square compared to a dog pelvis. See the dog flares out more here. Cat pelvis looks more like box. I'll flip a slide quick. You can go in your notes and see those. That's a cat. Here's a lateral view. This animal has some spondylosis going on here. We'll talk about that in a little while. Very good radiograph again. Here's L1, here's L7, here's the sacrum. Better look at the spinal films here. You can see the neural canal here, the long vertebra, and this is a myogram. Contrast medium around the spinal cord, and there's some back here. Extremities, look at knees on dogs. The lateral knee, I guess, blurry. Carpus. Notice a young dog, a few growth plates. Again, dog. Pelvis right here. Femur, tibia, fibula. There's calcaneus, knees. These are pretty good. So dogs have what are called flabella, which are sesamoid bones embedded in the tendons of origin of the gastrocnemius muscles. Contraindications to adjust, and this is critical. You don't want to adjust a fracture. Malignancy is not. When a dog has cancer, you can adjust them, but you're sure not going to adjust the area of the malignancy. That's a concern there. Infection, again, osteomyelitis, be careful there. Acute muscle strain, acute ligamentous strain, metabolic disease that might affect bone density, serious disease processes that require surgery on bone, again, ruptured ligaments, things like that. Joint disease. I'm not saying I've never adjusted a joint, but be careful when you do that. Response to injury or disease, as far as bones go, bones decrease or increase density depending upon the stress. There's a periosteal reaction. There's also be a change in the size of the contour, or it should be size or contour of the bone. And oftentimes we change the bacular pattern. Periosteal reactions, you can see eliminated, which is a aggressive periosteal reaction. Remember, the periosteum is the connective covering that covers the surface of the bones. You see a smooth linear reaction, let's say, which is a stacking, radiating or sunburst effect, like it's exploded. And you can see Codman's triangle. Codman's triangle is an elevation of the periosteum, not a good sign. Again, here's a bone tumor. Here's elevated periosteum. This is Codman's triangle because a bone tumor is undermining the periosteum, pushing away from the bone. This reaction here is a palisade type reaction. It's like a bunch of sticks put in here. Sunburst, you see it looks like an explosion. This is usually associated with sarcomas and not a good sign. This is just a periosteal type reaction here, more of just a linear type reaction. Different pathologies. I'll just go through some of these, just kind of different type of pathology you see on these. Ununited olecranon process. Some of the olecranon will not adhere to the ulna. Of course, this is where the triceps inserts, and you can see lameness limbs of these dogs. This is a surgical type repair. Hip dysplasia, a lot on hip dysplasia out there. Let's see if our videos work here. If they do, we're going to be in good shape. If not, you can try to watch these on your own. You never know when you press these where you're going to get these to be pulled up or not. There's a lot of good videos on YouTube that show things as far as hips go and hip dysplasia. See if I move this over here, this is going to work for us. Forgive the delay here, folks. This doesn't work pretty quickly. It works on my slides, and I try to run on this, and then I'll get these issues where it looks like it's turned out to work for me. So I'm going to close this down, and we'll try this one right here, see if this one works better. Well, at least, yeah, there you go. So splastic Rottweiler. Rottweilers are prone to hip dysplasia. You can see how narrow the hips look, how the dog swaddles his back. This dog is waddling his whole rear end like this is because it hurts to advance the coxofemoral joint. He don't want to flex that, so he uses his spine to throw his femurs forward, to walk forward. Basically, causes a lot of lumbar issues. These dogs are definitely candidates for adjustment. Can you fix hip dysplasia? The adjustment? No, but you can sure hit the spine of this dog. So one more time, just to watch real quick. I want you to watch how he throws this hip forward as he's walking. See how he flexes his lumbar spine laterally flexes it to throw the legs forward because he doesn't flex that hip. And so he uses his spine to advance limbs. It puts a lot of stress on his lumbar spine, so thoracic spine. You can see how narrow he is in the rear end. You can see him hop. Again, it hurts to advance limbs. He's hurting. This is painful to this dog. classic hip dysplasia dog. And all kinds of videos here if you want to explore this more. Sorry that it didn't work. It worked when I ran it before. Best laid mice and men, right? Here's a normal canine hip. Nice round femoral heads. Okay, sitting deep in the acetabular. This is normal. These are minimal changes, but you see how this femoral head starts getting this square shape to it? I start squaring of the femoral head, and I start worrying about early dysplasia. This would be a grade 1 hip dysplasia. This was, the radiograph was actually shot for the hips because there's a fracture, and you always look at the full radiograph, read it like a book. Okay, and there's the issue fracture right there, tube fracture. The grade 2, you see the squareness of the head. We're starting to look up to the acetabulum here. We're starting to see the femoral head out of the acetabular socket. The left side is worse than the right side. Here's a grade 3 hip split. You see the extreme squareness here. Starting to get osteophyte formation, secondary arthritis changes here. You're getting remodeling of the acetabulum and femoral heads. See how thick the femoral heads are compared to the thin there. Nice thin head there. See this, what a normal looks like. Nice thin femoral heads, nice rounded, nice clean looking joints compared to this joint. See how square it is. The grade 4, the completely dislocated acetabulum is basically gone. It's flattened out. The heads are completely out of socket on this. This is bad. Dog's a candidate for what's called a femoral head ostectomy. Which is what the FHO, they go in there and cut the head off the femur, and just like a sarcosis, or stenoarthrosis, just a false joint, if you will. And this is way past the point, I think, of a hip replacement. Now, what about this dog? Well, these basset hounds and bulldogs. These dogs that got these abnormal limbs in the first place, the contrastic breeds. This is probably a normal hip for this dog. How short the femurs are, how square they look, but not bad contact there, and the femoral hip pretty good. Patella luxations. This is a structural problem in these animals. The luxates medially. It's a little terrier, common in these small breeds. So do you see he's bunny hopping there a little bit? It hurts to flex his baffle. It hurts to flex the knee. You see how he put his butt up underneath him because his leg's sore. He's trying to pull the arch his spine. Almost like a dog, but these are knee issues. The luxating patellas, you typically luxate medially. This is due to fossa either being too shallow, so patella doesn't fit fossa, or the abnormal angulation of the limbs. Pretty common. He says his knees are not stable. He doesn't want to stand on them. He puts most of his weight forward. He extends his limb. He doesn't feel right. It's just so good. And it luxate medially. People bring me a lot of these animals. This is a subluxation or a complete luxation, but it's not something typically you can fix. Now you can adjust the tibia. Sometimes these dogs have medial tibias. I'm going to adjust the tibia on these dogs, and it helps in some cases. This is usually a surgical repair that this animal has to have here. This is something you got to fix surgically. Now, do I recommend this on? No. A lot of these dogs live normal lives with luxating patellas and don't have problems. What happens is every time this thing luxates, it's wearing like that on the lower surface, the caudal surface or posterior surface of patella, where the cartilage is, and you get malacia back there in the back of there. So you want to definitely look at these dogs and maybe get these. Surgery is definitely an option, and you want to get them done early before they become arthritic. Once they become arthritic, there's not a whole lot to do about these at this point. So think about recommending surgery for dogs and getting this done. I want to show you one here, see if it works. Again, so far we're 2 out of 3. That's not bad. Let's see what comes out and see if this one works for me. Again, I want you to think about it. And here is actually showing you this, and the it's actually palpating. There's the knee, there's the patella, of course the triceps muscle, the patellar tendon, and the patellar ligament, to the tibial tuberosity down here. And you see this, and this is more subluxation, it looks like more lateral, but they were doing, they're checking the patellas here. Up here, there's the patellar ligament, there's the patella, and the extend stifle, okay, an extension. Again, the kneecap should not pop out of joint, or the kneecap should not pop out. This is a lateral subluxation. Now, if the knee's bent, it's going to luxate bad. That's going to tend to lock it in place, so you won't have the knee in extension when you do this. There's a patellar, pretty significant medial patellar subluxation. You can see the angulation of this dog. You see the very close proximity of the tibial plateau here to the femoral condyle. Fractures, all kinds of fractures. Again, these are binary issues that have to be repaired. But you may see some complete versus incomplete closed fractures. You remember these from school. I don't need to go over these with you. Simple, only two fracture fragments, which is comminuted, which means it's more shattered, multiple fractured segments. Transverse is a straight line across a long axis of the bone. Oblique angle. The spiral tends to kind of wind around the axis of the bone. Avulsion means a little bony piece is pulled away from the bone. These are where our ligament attaches. Chip is at the bone margin. Epiphyseal separates the epiphyseal plate in the animal. And impacted, just one piece and kind of impacts beds on the other, and over the fractured ends override each other. Fractured epiphysis, you can see the slip of this epiphysis right here on this dog. This is the radius. Here's the ulna. Why it's important to take two views, because you really can't see this from the lateral view. You can definitely see it from the VD view. Fractured ends, you got to be very careful about this. And just animals, you can see the angulation here. This was a trauma case, hit by a car. Fractured accessory carpal bone, see a little chip taken off here. These are hard to diagnose. There's a little accessory carpal ligament that attaches down here. This accessory carpal bone is what you chiropractors call a pisiform. This bone here tends to, when it fractures, the caudal aspect tends to rotate up toward the radius and ulna, and it's painful. These are tough to diagnose, cause of loss, and tough to repair. Fractured scapula, again, hit by a car. There's a little green fracture right here in this tibia in this dog. Green stick fracture common in young dogs. Here's a fissure fracture along this radius. This is bad, obviously. This is lumbar spine, hit by a car, between L5 L6, L5 overriding L6. There's all little chip fractures here. How do people bring me these, want me to adjust these, you know, and because they can't afford surgery on these animals, and prognosis is, you know, definitely guarded because the spinal cord is here, then jumps down here and goes this way. So, you know, you could call in the spinal cord, but you call the lumbar nerves back here. Causes paralysis. Malignant bone tumors, something you need to keep an eye on, because you'll see these. They're brought in sometimes as lameness in these dogs, and something you got to consider whenever you're dealing with animals. These are cases, again, of veterinary referral to help these out, and these are not good. Bone tumors in dogs are not good. Here's a fibrosarcoma. There's no way to tell what this is by looking at the graph. This has to be a biopsy to diagnose this. Angiosarcoma here, again, no tell, this could be anything. Something's obviously wrong here in the ulna of the dog, but you have to have a biopsy to diagnose what this is. Osteosarcoma, this is bad. This is a distal. Here's a tibia, here's a femur, there's a patella, there's this triangle. See osteal reaction here, severe periosteal reaction, loss of bone, trabecular pattern here in this dog. This is an amputation case and probably euthanasia. These two are now well. By the time we get to this point, you're going to recommend a radiographic lungs, looking at metastasis, metastatic lesions. It's called a ball effect. Makes these round-looking tumors that grow on the dog's lungs. It has been my experience, though, at this stage, this is metastasized, whether or not you see the lungs or not. So this is typically just a short period of time to this animal's euthanized for this. Common locations for osteosarc: distal femur, proximal tibia, distal radius, proximal humerus. You can find them other places, but these are most common sites. Here's osteosarcoma. You see the sunburst effect. You see triangle going on here, the elevated periosteum. You see the loss of the trabecular. This is a distal radius. Here's the ulna here. Okay, this is bad. Here's a palisade type of appearance in osteosarcoma. This is a sunburst appearance. This is palisade stacked in there. This is slower growing, but again, the periosteum's elevated here. Okay. This is ways to treat bone cancer. Radiation therapy, although most amputation is recommended. Okay, as I said, it's not a good thing. And surgery, the bone sparing, that's if it's caught very, very, very early. Again, they're not good cancers. I'm going to tell you right now. Here's a lateral radiograph of the proximal femur of this dog. This is post, obviously. This is what the tumor looks like, and you just eating this bone all the heck. Actually, this is a proximal femur. Okay, it's usually on the distal femur, but this is what it looks like. Here's more of more palisade. I think it's kind of sunbursting to some degree, but you can see this triangle right here. It's a distal radius. Reticular cell sarcoma, again, there's no way to diagnose this except by biopsy. And again, is this a tumor? Well, it's a tumor for sure. If this was actually biopsied and this came back osteomyelitis. So this, you see this in a radiograph, think, oh my gosh, the dog's gets in there, it's actually on a radius, so you're thinking, man, this is the right spot. It'd be an osteosarcoma. I did a biopsy, so I was treated with antibiotics and resolved uneventfully. Other pathologies out there, is kind of a crazy condition called renal osteodysplasy. This is basically what happens is the kidneys, as a renal failure dog, causes phosphorus retention of blood, high phosphorus content, affects the parathyroid glands, and causes release of calcium out of the bones. And when I was in school, these raw. You could take these, a lot of times these are poodles or small breed dogs. The bone is so just osteoid, all the calcium's gone, the calcium matrix is gone from the bone, and you just have this osteoid matrix left. And so you just take these jaws and like rubber and just bend them. So obviously not good. Avascular necrosis femoral head, Lake Capitis disease. This is due to trauma to the accessory acetabular artery here. The obturator artery supplies the femoral head, and once that artery is damaged, you've lost blood supply to the femoral head, and then the femoral head to die and reabsorb. Typically, these are either going to end up as a hip replacement or a femoral head neck ostectomy to cut the femoral head off to help restore function. Pulsations, dislocations. Again, this could happen. T13N1, the narrowing here of the disc space, collapse of disc space. This is trauma, typically trauma. This is bad. This was a case actually here. It came into Parker, the animal chiropractic program, bought to a little bloody dog. She said the dog just wasn't right. This dog actually was walking though. Adjusted this stuff. It didn't do well. We sent it in for x-rays, and this is what we did. Our adjustment calls us no. The dog came in like this. Unfortunately, I was the one that adjusted it, and I did not adjust caudal lumbar here. I could palpate and tell something was wrong here, and my neural exam, believe it or not, was fairly normal in this dog. Crazy how some of these things turn out that way. Bad news. Here, this is a hit by a car. This was again a case that you can see the spine shattered. This is not good. There's nothing you can do in these cases. These animals are euthanized typically. Osteoarthritis, osteochondrosis, decans. You got a little. It's a cartilaginous deficit. Cartilage, your cartilage on the humeral head, and you get a little. This is really the fortunate to be able to see these. Typically, you can't see these on radiographs. They're as clear as you can here, but there's a little flap of cartilage here. This animal's laying shoulder, and you can adjust these guys all day long, and you got in there surgically a little flap of cartilage. Again, there it is, and that's hard to see on these animals. It really is hard diagnosis to make. The new sorry about that. Sorry for the noise here. The new digital radiographic machines tend to show these much better than the old machines did. Here's arthritis of the hip. You can see the lipping. You see here, see how dirty the joint looks. This is obviously a dyslexic dog. This was dysplasia. Now this is degenerative joint disease. Okay, so you got DJD, and this is a chronic degeneration of the joint. The joint capsule attaches, becomes thickened. It's in both sides here. Can you treat this chiropractically? Yes. Can you cure it? No. But some spinal issues because of compensation, like I showed you that Rottweiler walking. So what you want to do in these animals is adjust spine, and there's all kinds of supplements that help things like that. Newer drugs out. gallopant, things like that can help these dogs as well. Hemivertebra, these dogs, your pugs, bulldogs, Frenchies, things like that. These little dogs, they get these abnormal shaped vertebra, like these hemivertebrae, very abnormal shaped vertebra. Can you do anything about these? Not typically. You can adjust them, but overriding here of the spinous processes in the thoracic spine in this dog. There's nothing else you can do about these. Intervertebral discs, golly, this is a major thing you're going to see like this. This is a dachshund, and this dog is in grass and can walk fairly good on grass. This is called a walker. You see how drunk he acts, but yet he can walk, on grass and get down and function fairly well because he can't balance himself. He's got proprioceptive deficit where his feet are, but this is a spinal walker. He learns to walk using more of his spinal muscles to pull his hips forward. Very exaggerated condition you saw with that Rottweiler. But see, he has very little strength to really stand up. Once he gets going, he can go fairly well. And you'll see a lot of these in practice. But you see he's dragging himself a lot. Dogs are candidates for carts, dogs in carts. Here's a vertebral disc disease dachshund, and unfortunately paralyzed. This is two functions. Keep him from scraping his rear end up too bad. Too is it's also catches the urine and feces. He's and urinarily incontinent. You see atrophy over his spine, a pair of spinal muscles. But he's enjoying life pretty good. So I mean, as long as the dog's got a quality of life, my theory is let them live out their lives. I can't tell you how many of these. Here's a dog in a cart. This is very common. These carts right out there. This dog's got some function. He's trying to push his rear legs. You can see, but you see how he does with the cart. They do pretty well with little carts. They've got all kinds of carts out there. As far as when these guys walk, it's got to be fitted to the dog. I don't know if they have pressure right here over the spine. This is pretty nice here in front of you. See, his dog has fun. He enjoys life. Things are good. So I said, you'll see lots of these dogs in practice. Excellent radiograph. You can see some calcification of this disc material right here is indicated. You're looking here at the intervertebral foot. You're looking for a loss of this density, or excuse me, increased density in this increased opacity of this IVF. Okay, loss of this horse head, if you will, as it's commonly called. Here you see a bulging disc material on the spinal cord. This animal's got multiple problems. That's why radiographs help these guys out, or really help us see here. Here's disc material right here. You're looking for these, for a narrowing of these disc spaces. When the disc material prolapses or protrudes out, it causes the vertebra to come closer together. There's loss of density. Here's some calcified material in this IVF right here. Okay, and see this calcified disc material. You're not going to get that out chiropractically. We're going to talk to you about treating these guys, helping these guys out, doing traction on these dogs, adjusting these dogs. There's ways to treat this. Wobbler's disease. Wobbler's disease is a disease seen primarily in young Danes and old Doppies. And this is a young Dane, and they call them wobblers because they walk like they're drunk. And they wobble. They wobble. This is a cervical vertebral instability. Typically C5, C6 region. These this guy's in the snow, obviously, but if you can see how his rear end, he tucks his rear end up underneath him, he bunny hops, he's weak in the rear end, he's got these upper motor neuron lesions in his back legs due to this wobbler condition. Almost a little, again, the dog doesn't know me, but you see how weak he is in the rear end, how he bunny hops, he has a hard time standing. He's having a real hard time in the snow, I would think, to be honest with you. You can watch, and I left this on so you can click multiple videos here to see the condition. But this is, again, seeing young Danes and oldies, C5, C6, usually a tilting of C5, the rostral or cranial portion of C5 tilts dorsally. Wobblers. They wobble at their. So here you can see dogs. Here you can see this tilting. You see this collapse. Look at this radiograph down here. Here's a myelogram. Good disc space here, and you see we got this lost disc space. We got this here. We got this. This is almost like a herniated disc. You get the slipping of the vertebra. Listhesis. You see the narrowing here. You see this tilting and compression of the cord. This is an MRI, obviously. You got good cerebral spinal fluid all around the cord here. You got some compression here. But this is where the lesion is here. Traction helps these dogs. Here's spinal cord compression right here due to disc material rupture. This would be more vertebral disc disease. Typically with water, there's a tilting, dorsal tilting. A lot of these dogs adjusting. So again, young Danes, old Danes. Spondylosis, this bridging, this calcification of the ventral longitudinal ligament. I've had veterinarians and neurologists tell me this causes no neurological problems. I disagree. I think it does. This is almost like a lumbosacrosis going on back here. You see the bridging here going on in this radiograph. This dog came to me. Again, lateral view, liver, spleen, stomach, air in the intestines, little urinary bladder back here. This dog, you can see the spondylosis going on right here in this dog. So you're getting, the body's trying to fixate this segment because of abnormal motion going on here. There's more hypermobility above and below these segments. Okay, I treat a lot of these older dogs who had this and we seem to help them. So there's some going on back here in this dog as well. Pretty significant lumbar spondylosis. And again, this is fused, but this is trying to fuse. Discal spondylitis, inflammation going on here. This is an infectious process. You can see it's actually eating away the disc here. This is, you can see the degeneration of the vertebral disc. The infection is actually eating away the disc here, and eating the disc away. This is a condition where this dog's going to be on antibiotics, appropriate, probably intravenous initially antibiotics, trying to treat this. Sometimes don't have very good outcomes. Well, I've tried to show you a bunch of different things, and golly, there's so many things we could talk about, and just a quick little overview of things. And these are all veterinary things that need to be treated by a veterinarian, but in general, that was my alarm, tells about time. So, hey, you guys have a super great day. If you have questions, ask us in the module 3, and I hope you have a great day. I hope you enjoyed this. Thank you.